I'd like to begin by acknowledging that this meeting is being held on the traditional lands of the Kulin Nation and pay my respects to elders both past and present and to elders from other communities who might be here today. So this is the agenda for today. So I'm going to talk a little bit about the Foundation's role. I'm going to talk about our public health approach. I'm going to outline some of our previous prevention grant programs, and then we'll talk a little bit about the Prevention Partnerships program for 2019-21, which is exciting. Take some questions, and then you'll have an opportunity to meet and mingle, which you've clearly been doing. We've brought that forward up the agenda, and then we'll follow with that with a light lunch. About the Foundation. So some of you may be familiar with the work of the Foundation. There's clearly some people that we've previously funded in the room, which is good. So the Foundation was created by the Victorian Parliament under the Responsible Gambling Foundation Act, specifically to address the challenge of gambling harm in Victoria. So administratively, we sit along with the Office of Gaming and Liquor and the Victorian Commission for Gambling and Liquor Regulation in the Justice portfolio, so that we have an administrative connection to the Department of Justice and Community Safety. Our foundation is governed by an independent board, which is responsible for providing strategic direction and ensuring that we achieve our objectives and carrying out our functions. And the board is ultimately accountable to the Minister for Consumer Affairs, Gaming and Liquor Regulation, which is Marlene Kairouz, MP. So what do we do? We use the best available evidence in partnership with others to prevent and reduce gambling harm and provide support services to those affected by gambling harm. And we also fund a range of professional support services that are available to anybody in Victoria who experiences or at risk of experiencing gambling harm. So we work to reduce gambling harm through information provision, research. There's a big research arm in here. So we fund research grants for areas of study that build our knowledge of how gambling affects the Victorian community. We fund our prevention programs, which is my team. So that means we work in partnership with a range of stakeholders to exchange ideas, learn from different perspectives and develop more effective ways to prevent gambling harm. We also have a large support service that we fund, and Tom's here from the Gamblers Help team. So if you've got any Gamblers Help questions, direct them to Tom. So then we also do policy advocacy to governments, using our research and evidence created through our research arm, and then we have behaviour change campaigns. So you may have seen the latest one. It has the beach ball slowly inflating and talks a little bit about how that might be a sign of gambling causing stress in your life. The Foundation's adopted a public health approach that focuses in particular on raising awareness about the risks associated with gambling and its normalisation, and recognising the early signs of harm and mitigating that harm through a range of partnerships, community grants and programs. So the heavy promotion of betting, especially on sport, it really normalises gambling without addressing the harm risk. So the more we see it, the more we think it's normal, the more we think there's no risk associated with it. And a big part of our public health approach is our Prevention Partnerships program, which is supporting a broad range of community-based, not-for-profit, local government and public health organisations to test new approaches to preventing or reducing gambling harm. So I've put this up here as the continuum. So the majority of gambling harm in Victoria, so 85%, is experienced by those identified as being low and moderate risk gamblers. So common types of harm include emotional distress, reduced saving, reduced money to spend on family or recreational activities, relationship problems, financial difficulties and work or study performance issues. So in our packs today, and I saw some of you flicking through it, we've included a copy of a report that you might find useful. It's called Hidden Harm, Low Risk and Moderate Risk Gambling. It's actually quite engaging the way it's been presented, and that might be helpful for you in your applications. So I just popped in here the key elements of our public health approach. So you'll see there evidence-based, skill development and capacity building, partnerships and collaborative approaches, and a comprehensive integrated practice. So of the people in the room, who's got a public health background? Who's that familiar to? Okay, so there's a good spread there. I think sometimes in public health, some of the language can be a bit can feel like a barrier to understanding what's happening. But so what we've done is create a foundation course that you can do online, just to familiarise yourselves with some of the core concepts of the public health approach. And again, that would be helpful for you in your application if you had the time to review that. And you can access that by sending Steve an email. to be provided with the login details. So some of you may be familiar with our previous prevention grants program. So since 2013, the Foundation's funded local, regional, statewide partnership prevention programs. And there's been 2 rounds of the Prevention Partnerships program, and each of those 2 rounds went for 2 years. And then in response to findings through the evaluation, we've also done 2 additional capacity building grant rounds. So we did a grant round for culturally and linguistically diverse communities in 2017-18, and we did a grant round for rural and regional communities in 2018-19. For this current iteration of the Prevention Grants Program for the period 2019 to 2021, that capacity building has been picked up into the main program. So there's 2 streams of funding, and we'll come back to that. But we won't in future be doing, or in the foreseeable future, be doing separate grant funding for cold and regional and rural communities. So for the Prevention Partnerships program in 2017-2019, there were 14 projects that were funded to test new ideas and deliver innovative prevention initiatives. And we've produced a short video that I think we will use to highlight that.
Hello all, welcome to the very first episode of this exciting new podcast series, Not a Dollar More. My name is Shane Rogers, and this is Australia's first podcast series dedicated to helping people who want to make changes to their gambling.
It's fantastic that people have an opportunity to be able to speak to somebody that's gone through it. The day-to-day struggles, the struggles with not being able to afford to put petrol in your car, all these things that people can't talk to other people about, I think this podcast is going to be great for.
One of the most rewarding aspects of working on this podcast series is being able to work on something that is different to a lot of the other services and help and support that's out there at the moment for gambling harm. We can capture a whole bunch of stories and have them available to everyone. Is really about inspiring people to think about what's happening to them. Kind of go, oh, that's possibly me. I hadn't really thought about it. The beauty of that medium is that you can access them anywhere. They're free. I think the podcasts could definitely give people hope that things could change for them.
Neighbourhood houses are a great place for people to connect when they feel socially isolated. It's almost a third place, not their home or their workplace. They can come and connect to the varied activities that we offer, feel safe and secure, and make new friends. Sometimes people need to reflect on their behaviours, and having a conversation with someone can trigger a support mechanism. Through this project, our staff and volunteers will be trained to recognise the signs of gambling harm and to refer people onto services or connect them into community activities. We're all embracing the opportunity to raise awareness of gambling-related harm and provide alternatives to our communities. The Chaos Network with our 30 houses recognises the impact that gambling has on our communities, so we were very proud to be part of this project.
We've been delivering the Family Wellbeing Program in Mildura, Swan Hill and Kerrang, and that's been totally well received. When people are talking in groups about topics that are a little bit sensitive or a little bit uncomfortable topic, once somebody starts to talk about it, the gambling and responsible gambling and gambling harm, then others are able to say, you know what, I think I have a gambling problem. So it's being able to actually bring out the conversation in a positive way without judgment. For the elders, definitely the yarning circle model, it mimics the kind of social environment they'd have at bingo and the conversations that are coming out of it. Although there are serious conversations, especially around gambling, drug addiction, mental health, it's easy for them to talk. I've not seen the elders so engaged and so able to talk and share. Always those topics that have a lot of stigma attached to them, you need to approach that with humour. Being able to talk about serious issues with humour enables things to actually not seem so bad, and it makes people more comfortable to share. Aboriginal people share stories, and we have for thousands and thousands of years, and for that reason you learn more by sharing your story than telling people how they should do this or how they should fix that.
So this is the full scope of programs that were covered under the 2017-19 funding round. What we've done is print out and put up around the room that you might like to have a look at short descriptions for each of the programs rather than me going through them here. We thought that might be helpful for you in preparing any applications that you have. There's also quite detailed information on our website which you might like to have a look at as well. Now, we were going to watch a short video about three sides of the coin. We did lose a little bit of time this morning due to the drilling and the microphone. Would anyone still like to watch that video? Yep. All right. So, are you familiar with the work of three sides of the coin? Yes. Oh no, there's a few nods around the room. So three sides of the coin is quite an interesting and innovative project. So they work with people who have suffered due to gambling, and then they use them to work with them to develop through creative workshops. They share their stories, which are then developed up into performances. And then the performances go out and create awareness of gambling-related harm in the community. And there's a particular emphasis on taking the performances to health professionals and other people who work with gamblers or work with people who perhaps might come through their doors who might have a gambling problem, to really encourage them to think about that and think about whether they need to be asking people about their gambling. I'm not doing it justice, the video will.
You've got a tough life. Come here. I've got something that'll help. Because I went there to escape. And I did. It worked. It was perfect for me. It's a product that's designed to zone you out, take you to another place, and take over your brain so that you don't have to think. And it worked perfectly until the solution became a bigger problem than the problem.
I'm a nurse and I work nights.
Fantastic. It's only 1 o'clock in the morning. I'm not ready to go home. I'll put in more.
$50 in? What? It's gone? What are you looking at, for goodness sake? Driving my luck away.
We were just talking, sitting in front of the TV, and he started crying and said that he didn't have any money left in his account. I was literally alone with the child and nobody else around me. Even the relatives that I thought were there wouldn't talk to me anymore, so... Sorry.
Let me entertain you. Let me see you smile. And if you're real good, I'll make you feel good. I'm very versatile. Let me entertain you, and we'll have a real good time, oh yes sir.
I really like that video, and I really like the work that they've done, and I think it's a really good example of the types of work that we can fund through these grants. And I just wanted to show everyone so that you could get a sense that there's quite a lot of scope for innovation. And sometimes, I've worked for government a long time, and sometimes government can be quite risk averse. And while we're not certainly, I'm not standing here saying we're going to fund, anything truly risky, we are kind of open to a discussion about, thinking outside the square. So that's just a snapshot of the various different grants that were funded under the Culturally and Linguistically Diverse Communities grant round, and the Rural and Regional Communities grant. So we've got Vicky here today, who was one of our Rural and Regional grant recipients. Is there anyone else in the room who's looking at doing work with rural and regional communities? Okay, excellent. So we've got a good spread of the prevention projects across Victoria. You can see from the maps here and across Melbourne. Wanted to touch on the evaluation approach. So you would have seen as a foundation of our public health approach to how we do things in this foundation. We're very committed to evaluating our work to test its efficacy. There's an evaluation approach that's been in place for all of the grants programs since their inception. And our evaluator has developed a framework that details that approach there. And then we've also got some key initial learnings that are summarised here, but what we've also done is included for you in your pack a summary of the evaluation as well. So now move on to why you're all here today. So, Prevention Partnerships Program 2019 to 2021. I thought we'd start with the important dates. So, expressions of interest close the 21st of June. The full applications for shortlisted organisations will be due 31 July. And then you'll be ultimately notified of the outcome in late August, with the funding to roll out from August. So you should have hopefully seen the key documents, the funding guidelines and the expression of interest document. Everyone's got those, seen them, had a look at them. Excellent, everyone's, a few people nodding. Anybody who couldn't find them had trouble? No, all right. So what's the aim of the program? So the aim of the program is to help prevent and reduce gambling-related harm within communities across Victoria. There's $2 million, there's a pool of funding of $2 million over 2 years from 2019 to 2021, and the funding period's up to 21 months, so August, September 2019 through to 30 June 2021. And as I indicated earlier, the funding is available in 2 streams, so smaller capacity building projects, which aim to raise awareness of gambling harm, and that funding's between $25,000 and $100,000. And then there's larger innovation projects, which are for innovative primary prevention initiatives, with funding between $100,000 and $200,000. One of the things that we can do between Steve and I today, and you might like to have a chat with us after I've finished, is help people work out which grant funding stream they'd be best placed to apply for, if anyone was wondering about that. Talk a little bit more about the capacity building stream. So the capacity building projects are aiming to raise awareness of gambling harm. So there's objectives there, which you can read them on the screen. These, the projects will be similar to the types of projects that were funded under the COLD communities and the rural and regional communities grants. So we showcased a couple of them, and I've got some more videos, short videos to show you in a minute, but they're really about raising awareness within your communities of gambling harm and facilitating conversations and providing opportunities for alternate recreation. So workshops, community forums, community training sessions would all be the types of activities that would work there. So the innovation stream. So these are the larger grants. That's for innovation in delivery of primary prevention initiatives to at-risk communities. Is anyone not familiar with the concept of primary prevention? I'm going to take the absence of response to mean that you're all over primary prevention. All right. So we've got the objectives up there. For applications in this stream, we're looking for projects that show innovation in the way they're addressing gambling harm in the community, as well as contribute to the evidence base for gambling harm prevention in Victoria. So we're looking on projects that focus on subpopulations and setting where the need is evident. So there's quite a lot of information on our website around communities that are more vulnerable to gambling harm. And so they would be the communities that we would be looking to target with those grants. Move on to the expression of interest process. So has everyone had a chance to have a look at the expression of interest form? It's a weighted criteria. So the project summary, alignments with objectives, organisational capability and value for money. Value for money is an overall assessment, so that's not weighted. The alignment with objectives. Okay. So if you are applying for a capacity building grant, we will, where are our alignments? Okay. So capacity building grants need to demonstrate that their project aligns with the following objectives. Raise awareness of professionals and community members on gambling harm as a public health issue and the risks associated with gambling. Facilitate conversations to break down stigma around gambling and promote help seeking. And implement projects that aim to reduce gambling harm, including alternate recreation activities. All right. So for the innovation grants, there's a 25% weighting for innovation and a 25% weighting for primary prevention. And they will also need to address the objectives, which are to deliver innovative gambling harm prevention initiatives and test new ideas, demonstrate a primary prevention approach aiming to prevent gambling harm before it occurs, focus on subpopulations and settings targeting at-risk groups, build evidence for effective practice in the prevention of gambling harm. So you are welcome, say for example, if you were applying for a capacity building grant, to address all of the objectives in your application, but you don't need to, and your application is probably better off being concise rather than wandering over into the objectives that are outside the scope of your funding. So who can apply? Is there anybody in the room who's not sure if they're eligible to apply? Everybody's pretty confident they're eligible to apply, which is good.
What are the criteria first?
Okay, so we'll get to that. So you need to be a single corporate entity. So that includes not-for-profit, social enterprise, local government and community public health organisations, but individuals or sole traders are not eligible to apply. One application per organisation. We'll come back to partnering. All funding must be used for community benefit, so it can't be used to generate a profit for individuals, and it's open to entities operating in Victoria. So this is Victorian government money, very focused that it's delivering outcomes for Victorians. With having said that, we are very, very keen on applications from organisations that are servicing rural and regional communities, Aboriginal communities applying themselves, and culturally and linguistically diverse communities. So there's some criteria that's assessed in the funding guidelines around the way in which we would work with Aboriginal communities, which is in line with our commitment to self-determination. So therefore we would privilege or preference funding flowing to an Aboriginal community controlled organisation first and foremost. And in the event that there was an organisation who worked very closely with Aboriginal communities, we would need a letter from those communities, I guess, to talk to the extent of that relationship. And there is also the organisation, if the organisation is not an Aboriginal community organisation, they will need to outline both their previous experience working with that community and their commitment to employing Aboriginal and Torres Strait Islander staff and or consultants. And similarly for cold communities, where the applicant is not an organisation that is governed or led by that community, we require a supporting letter from local organisational community groups that you aim to work with that talks about your previous experience of working with that community. So for collaboration and co-funding, so there are a number of our projects that, previous projects that have been delivered by a collaboration of people working together. So where there's multiple organisations involved in delivering the project, they need to nominate a project lead. So for example, some of you might be familiar with Libraries After Dark, which is led by Moreland but works across 4 councils. But Moreland are clearly the project lead. And in that instance, the funding agreement is between the foundation and the applicant's legally responsible for delivering the project. And you are permitted to source additional funding, co-funding from other bodies, and the nature and extent of any co-funding arrangement needs to be detailed in the application form. So what will we fund? Project proposals that align with the funding requirements and the guidelines, costs associated with day-to-day monitoring of the projects, overhead surcharges, management costs, administrative fees, up to a maximum of 25%, reasonable reimbursement of staffing costs for existing employees that are delivering agreed activities, and the design, publication and production costs for material and collateral. It's important to note that where we're talking about production costs for materials and collateral, the foundation branding, if you intend to use our foundation branding, then we need to be provided with the opportunity to review the materials. Yeah.
All these guidelines, are they available anywhere?
Have they?
Yeah.
Yeah, so we've...
Can we access these?
Yes, and we will give you a copy before you leave today, and we're happy to answer any questions about it. And then this content has been lifted directly from those funding guidelines, in the grand tradition of recycling things we already wrote. So, moving on, some additional things we will fund. Reasonable advertising or media costs, reasonable costs of facilitation for approved events, and reasonable costs for travel and conference attendance. When we're talking about travel and conference attendance, You need to submit a written request to the foundation, and if you're presenting on the project, we're only going to pay for domestic travel. What will we not fund? So applications from non-incorporated entities, capital works and the purchase of equipment, which would include vehicles, commercial activities that have no community benefit. I think I just read that as commercial activities that have no, public advocacy for particular government policy position as opposed to promoting awareness of gambling harm. If anyone wants to tease that out a little bit or discuss that further with us, we're happy to. Evaluation of existing policies or programs. Having said that, we are open to the idea of scaling up existing programs. Applications where the majority of funding is allocated to alternate recreation activities, deficit funding of organisations. Also on the list of things we will not fund, activities that are otherwise the funding responsibility of local, state or federal government, projects or materials that duplicate work that currently exists or has been previously funded by the foundation. And again, as I said earlier, if you're talking about scaling up an existing project, we can look at how to sort of, I guess, tease that out and unravel whether, where scaling up starts and duplication ends.
Please.
Yep.
The second point, please.
Yep.
Can you elaborate on the second one?
Yeah, projects and materials that duplicate work that currently exists. Yeah, so I think we can talk further about that. If you have a project that you are currently working on that you'd like to take further, that's what we can discuss. Steve and I can discuss I think in the context of a specific example. So we are open to the idea of scaling up existing work, but I guess it's around, sometimes it's a fine line between where duplication ends and scaling up starts. So you might be delivering a program and you might have had a limited amount of money and it might be for 15 people, and you might want to take the same program and deliver it to 150 people or 1,500 people, and we can talk about that, and that would be something that you could receive money for.
Yeah, because from the African Australian community, we have some members who have connection with government departments. What established relationship with government officials?
Yep.
Therefore, they can easily have access to grant, apply for funding.
Yep.
And then, so we're going to do this for African communities.
Yep.
But in fact, very limited project to the extent of that project to benefit the community. They say they want to support through the provision, delivery of services, the promise the government. Nobody sees the benefit.
Okay.
Nobody hears about it.
Okay, so are you
so
talking?
What I'm saying is that it's very. You guys have to be very careful when you fund projects within communities, because there are communities within communities, especially when it comes to African communities.
Yep.
So that's the point I want to make.
Yep. All right.
The demographics are very different.
Yep.
Different needs.
Yep. And I guess in establishing that deeper level of connection with community and making sure that we're targeting very specifically with our project, we're really open to that. We're really open to the distribution of grants to make sure that we're meeting the needs of those communities. But we can talk further about it, and we can talk further about any concerns that you have. All right, so one of our roles in our team is capacity building and support, which means that you're not on your own in delivering your grant, because we're collectively working to build the evidence base in Victoria. So what do we bring to that equation? We bring the funding, but we also bring support. So we can provide general guidance on funding guidelines, project ideas, and clarification regarding the application process. We have a professional development centre in here, which offers a number of courses, including the online course around the Foundation's approach to public health. That's one slice of a much broader online piece of training that is available. And then access to the Foundation's information on regulation, statistics and publications. Just through there is our Gyro, which is an information centre that you can make a booking to come in and use. And we also have quarterly forums. So, what are the reporting requirements? Funded organisations will be required to attend an orientation session and subsequent quarterly forums, complete a detailed project work plan, complete a project logic and a data collection plan, complete project progress reports, and complete a final evaluation and performance report. So it's important to distinguish here between an evaluation that you may wish to conduct of your program versus an evaluation that will be conducted or your participation in the broader evaluation program that we have going for all of the grant funding that we distribute, and so you will be supported in your participation in that. So at the moment we have a rolling 3-year evaluation that covers the Prevention Partnerships program. We also have some strategic partnerships, which is what happens when you are a very, very successful grant recipient. You graduate to becoming a strategic partnership. So we're currently rolling out an evaluation of them, and then also rolling out an evaluation of our community engagement program, which is through the Gamblers Help Agency. So all three, in government we love our TLAs, our 3-letter acronyms. So the Triple P, the SEP, and the CEP are all being evaluated as part of a 3-year rolling evaluation. So it's one of the jobs of my team is to facilitate the connection of grant recipients back up into that evaluation program to make sure that everyone is collecting the information that they need, and that then we can have this collective view of how we're gauging our impact. The evaluation requirements, which I preempted, and now have all the information that I need right in front of me. So we've funded an ongoing evaluation of our funded prevention initiatives. The funded organisations will be responsible for working with the evaluator and undertaking data collection, monitoring and reporting of their projects. And the funded organisations will also be required to participate in the overall program evaluation. So the overall, just so that everybody is really clear, the overall program evaluation commissioned by us will not include a detailed individual evaluation for each of the funded projects. As Steve outlined, applicants are encouraged to cost for this component of the work within their proposed budgets up to 10% of the overall requested funding amount. And if organisations wish to complete an evaluation of their project specifically, they may do so, but they'll need to account for the associated costs within their proposed budget and will still be required to participate in the Foundation's overall evaluation.
So is there an indication then if that is the case? Because
yep.
Obviously it's important for an organisation to have that information
yep.
in terms of developing the work. What sort of financial framework is in place for that in terms of expectation of the organisation doing their own internal or their own evaluation of their work to be able to kind of move ahead rather than stuff that's being fed into the big?
So do you mean in terms of disentangling, if we're allocating 10% of your overall budget towards participating in our evaluation, how much more of your budget would you anticipate to be allocating for your evaluation?
That's exactly.
All right, that's probably a question that Steve and I will need to take offline. We can provide an email update after this with some guidance around, I guess, what has been past practice and what we would consider to be a fair approach moving forward.